Good afternoon. Can you hear me? Okay, good afternoon and welcome to May's first Friday Luncheon. Our board president, Brian Sear, is out of town actually watching his daughter graduate from college, so you just get me today. At this time, we would like to ask Pastor David Hunt with Eastview United Pentecostal Church to come forward and say our invocation.
Father, we're so thankful that we can come before you and talk to you. When I consider all that you have done, I worship you. Consider all that you've done for us, I thank you. God, everything that is around us, the beauty of this day testifies of your infinite power and your wisdom and your might. So we give you praise. But to think that you, the God of creation, will become our wonderful Savior and Redeemer. We are thankful today. We seek your grace and your mercy and your blessings in our lives. In the wonderful name of Jesus Christ. Amen.
Amen. Thank you. Thank you so much. We are so excited to have several new investors join us today. And when your name is called, would you please stand so that we can acknowledge you? Farmhouse Bakery, I know they're in the back. Glad to have y'all. And sitting right next to them is Farmhouse Frozen Yogurt. Palm Harbor Homes. They're in the back. Piney Woods Oral Surgery. Rogue Prosthetics. And Texas Size Selfie. They're probably still in the back taking photos, but there they are. Make sure that you take an opportunity to welcome these new investors. It's always kind of difficult and weird to come into your first Friday and it's a sea of 150 people, but please welcome them, encourage them to get plugged in because it is all about the networking, and if you get plugged in, you will get things back from the chamber. So welcome. We're honored to have you as new investors. We also know that it takes sponsors to make events like this happen, and we'd like to take an opportunity to thank our sponsors. Our first Friday Luncheon sponsor, Lufkin Coca-Cola, Lynn and all of her staff. Thank y'all so much for all that you continue to do for the chamber. Please help me thank them. And I also want to acknowledge the fact that they have put all of these Cokes and water bottles on the table for this last several months. Today they've got Coke with a little bit of coffee in it. So make sure that you open up those boxes, take a sample out of there, take it home, try it. But we appreciate all the samples and donations that y'all done as well. And we'd also like to thank our on-time monthly drawing, which is presented by Serve Pro Lufkin of South Nacogdoches. Thank you for doing that as well, Candace and Patrick. We are excited to introduce two new, brand new employees to the chamber, and I see them in the very back. But we are excited. Colleen Murray is going to be our new administrative assistant. She will actually start on Monday, and Jessica Hill is going to be our new director of the leadership program. So when they call you and tell you that their names are Colleen and Jessica with the chamber, please believe them because we're excited. We have a full house. We now have 8 employees. Some are part-time and some are full, but we're excited to have Colleen and Jessica join the chamber. And I will introduce them again in a little bit because they're still welcoming people in the back. Today, we're honored to welcome Dennis Cullinane, CEO, and Donna Spann, Chief Advancement Officer with the East Texas Food Bank. Dennis joined the East Texas Food Bank team in March of 2010 from San Marcos, California, where he was the Senior Vice President of Operations at Centerplate. His combined 30 years of experience in the food industry has given him a valuable experience in organizational development, strategic team building, financial analysis, inventory management, and distribution pipelines. Donna Spann joined the East Texas Food Bank in October of 2016 after owning and operating Capstone College and career advising. Donna oversees the development and communications activities in the East Texas Food Bank. She has a rich history of nonprofit management as the director of the East Texas Regional Branch of Prevent Blindness Texas and the director of Children's Miracle Network at Mother Frances Hospital. Please help me welcome Dennis and Donna.
Well, thank you so much, Tara. What a beautiful day in Lufkin, Texas. Would you agree?
Absolutely.
Yeah, this is awesome. We're just so happy to be here. Let me get the, so how this works is, so the East Texas Food Bank, our mission is very simple. We exist to fight hunger and feed hope in East Texas. And our vision statement is a hunger-free East Texas. We work hard every day to provide meals for everybody, the access to meals that people need to lead a healthy and thriving lifestyle. And I'll just give you a brief overview of what our organization does broadly. We just celebrated our 30th anniversary. Now we're 33 years old. We were formed in 1988 as originally an offshoot of the North Texas Food Bank, which is in Dallas. And we're one of the 200 food banks in the Feeding America Food Bank Network. There's 21 of us here in Texas under Feeding Texas. And we run programs that are targeted towards helping people become more food secure and to become more independent in their daily living. And three main areas that we do this is we like to call them the feed, strengthen, and lead priorities. Feed is pretty straightforward. You know, we really, that's one of our main purposes, is to provide support to pantries, soup kitchens, and organizations, feeding organizations all across the 26 county service area that we service. And we're really in our southernmost county here in Angelina County in Lufkin. But we have several programs through those partner agencies. We run a fresh produce program, which is so important from the nutrition content and the quality of the meals that we try to provide. I have senior box programs to provide supplemental foods to our seniors who may be homebound, or that we can also have people deliver those to different sites throughout our pantries. And we also find kids to be very special to us as well. We look to try and fill the gaps to where children may not have access to healthy meals. And one of our most popular programs is a backpack program that provides children a backpack that they can take home every weekend. And it's operated really at the school level, and each of the programs are operated on their own, and mostly they're run by the schools. So sometimes they're discrete, and sometimes they're actually run with students who actually volunteer and help each other. But that's a very, very popular program. I think we're serving about 6,000 children a week now through our backpack programs. So the other gap is after school. And what we find is that children after school, when their parents are working, become latchkey children. What we try to do is support programs like the Boys and Girls Clubs and other programs in schools, and provide snacks and meals at the school. And what that basically does is it attracts the children to stay after school and participate in recreational activities and counseling, and helps them with getting their homework done. So we love that program as well. And so in the summer food program is another popular one. There's a gap, when school kids are out of school for the summer. Families that are resource challenged, the school breakfast and lunch programs fill a big need, a big part of their budget. So our summer food program really tries to pick up in targeted neighborhoods where if those meals are missing from a family, we can help support them through that. Strengthen is our programs that we try to help people use resources and become more self-sufficient. We've got nutrition education classes that we try to augment with the foods that as I mentioned, we focus on healthy foods, but we try to teach people how to manage their food budget, how to make sure that they're not wasting food, and how to make proper choices, not only from a nutrition standpoint, but also from value. And we our nutrition classes will take them around to a grocery store and actually do tours and show them how to read the labels on the shelves. They can compare values and also with the nutrition literacy. And we are forming some partnerships and health programs with healthcare clinics and hospitals. We've got a pilot program with the University of Texas in Tyler, Northeast Texas, that has been operating for 3 years now. And the COVID had interrupted some of our work with them, but what that basically is when you go to the hospital and you fill out the questionnaire, there's a couple questions that are related to food insecurity, and if a patient answers yes to either one of those questions, they become eligible to get into a cohort, and we were able to provide them, enroll them into a 6-week program where they get a box of food, and they get nutrition education counseling as part of their healthcare regimen. And as part of the strengthened process, we also help people become eligible for benefits that they can get, like SNAP, TANF, and Medicaid. So we try to provide those services and also train our pantry leaders to do that as well. And leading is what we're doing here today, is that we're here to organize you, to inform you as to the needs of the community, also to advocate for people that are in need. We participate with Feeding Texas and Feeding America at the state and national level on issues with regards to the USDA and other programs around the SNAP programs. And I think the one that we're focusing on this week is with SNAP, getting that vehicle asset test changed. It's an old law that we're trying to get modernized so that if you own a decent car, it doesn't count against your eligibility for SNAP or food stamps. So, but that gives you an idea of where the East Texas Food Bank works and how we do our work. The sad truth is that we're now the 4th largest food insecurity rate in Texas. Of the 21 food banks, we've got the 4th highest food insecurity rate. Not the highest population, because we're a rural food bank. We don't have a Houston or a Dallas, so we don't have as many people. But it's a whole different problem when you're trying to tackle hunger out in the community and out in our rural communities. But one out of every 5 East Texans is food insecure, or not knowing where their next meal is coming from. And even more profound, it's more acute at the child level. 1 out of every 4 children in East Texas is food insecure. So when you think about our 26 county service area, that's almost 240,000 people that may be needing to go to one of our pantries at some point during the year. And it also means about 70,000 children. So it's a big problem, and we're proud that we're able to help. So how do we work? We're a food bank, if you think about it. What we do is we aggregate funds and food resources for all of these partner agencies and programs across the 26 county service area. And we secure the food donations from a variety of sources. The United States Department of Agriculture through Texas Department of Agriculture is a good source of it. One of our largest sources is really through the grocery programs, with Walmart, Brookshire Brothers, and HEB, and throughout that service area, we make connections and manage donations directly to our pantries. We try to organize and make sure that those foods that are being discarded from the grocery store level are rescued and are brought right into those pantry programs and are put to use. Food waste is something that we really don't want to tolerate, and that program is so important to us. And I think last year provided us 7 million meals. So it really is a significant part of our distribution. We also have to purchase a lot of food. Not everything that we can get to round out a family's diet can be counted on to be donated. So we're committed to managing a list of about 20 things that we will never run out of. So if we don't have them in a donated stream, we make sure that we're purchasing those products. And then those are made available to our partner agencies on a co-op basis. We also work with growers and farmers for our fresh produce program. A lot of foods are sorted out and are culled aside. The ones that you see at Brookshire Brothers are the best. And we find ourselves in the ugly fruit and vegetable business. It's wholesome food. It's just not the most attractive that you might see, or they might be just by different sizes. So we try to rescue those foods as well in our produce program. And also, if there's overproduction in some crops, some farmers don't have a market. They can't. It doesn't pay them to harvest them. They'll just plow them under. So we work with Feeding Texas and the Department of Agriculture to help rescue those and pay just the cost of extracting them from the field. And it's about, I think the landed cost to our food bank is about 15 cents a pound, which is really inexpensive when you go to the grocery store and you see the price per pound of apples and bananas and the things that you're buying every day. But even though that's inexpensive and sounds inexpensive, each one of those trucks are about 40,000 pounds. And we go through about 5 truckloads a week. And each truckload can run between $3,000 and $5,000 to bring into the food bank and distribute it to all of our partners. So it's, we aggregate the funding to be able to provide those programs and to provide the nutrition. So we've got a big distribution center in Tyler, centrally located. We've got a fleet of about 10 trucks, semis, box trucks that go out throughout our service area delivering those products. And I think our warehouse is about 80,000 square feet. It's really like a little grocery distribution business. Computerized, our agencies order online. It really is a little food business in itself. And then, as I mentioned, the bulk of the heavy lifting is done with local volunteers and pantries and programs that are all through these communities. And you've got several great programs here in Lufkin, in Angelina County. So as I mentioned, we're 2,200 partner agencies is who we work through. We've got, in the 26 counties, it's 20,000 square miles. And the last time I looked, I think we're bigger than 4 states in the country as far as the service area that we cover here in East Texas. And last year, we were proud to say that we distributed, well, I think that was from 2020, 25.3 million meals. But in adjusting that for a pandemic, we hit 27 million meals last year. Thank you. And here in Angelina County, almost 2 million meals were brought in from the East Texas Food Bank. 7% of our distribution, and we're really proud of that. This remains to be one of our most underserved counties, though. We've just completed a strategic plan, and Angelina County is an area of focus for our food bank, and we've been taking some additional measures to ensure that this community can continue to be served and thrive. So what does that mean in East Texas? In 26 counties every day, we feed more families, we feed more children, we feed more seniors than any other hunger relief organization here in East Texas. And we're proud of that. And we're not the only hunger relief organization. I'm sure there's others that are out there that are not affiliated, but we're carrying probably 90% of the load and organized through Feeding America and Feeding Texas. So what does that look like? This is a slide that any of you can access through Feeding America's website. It's called Map the Meal Gap. And it's a really neat tool where you can click on the state of Texas and you can click on one of the orange dots for the food banks in Texas. And if you click on us, that's what you'll see a bigger map come out, and then you can click right onto Angelina County and sort it by the food insecurity rate overall here. You can take a look at your statistics, and that shows you, and these are numbers from the Feeding America site, so they're not completely up to date with the pandemic numbers, but overall, it's over 15,000 people here in Angelina County are food insecure. Now, does that mean they're all going to a pantry right now? No, it doesn't. But it means that there's a possibility, a high possibility that they may be one crisis away from needing help. And during the pandemic, one of the things that we found and observed here, and especially here with the work that we did at the George Henderson Expo Center, and distributing foods at those mega food distributions, which we were still doing once a month, is that almost 40% of the people that we were serving in those lines had never asked for help before. They didn't even know how it worked. And that was kind of heartbreaking to see that. And because we had some real tough times there when all the restaurants started closing down, and it was just a cascading effect of some economic carnage that sent a lot of families needing help at some of those distributions, and we were proud to be able to do that. But your overall food insecurity rate here is about 17.9%. As I mentioned, it's over 15,000 people, and for food stamp eligibility, SNAP. You have to be at the 185% of the poverty level, and the poverty level is really, really low. I think per person it's like $9,000 or $10,000 a year in average income. But at 185% of that, you can be eligible for SNAP. And the only reason I'm explaining that to you is because 69% of the population in Angelina County is eligible for SNAP. So there's a drastic need here, and that's why we're working with urgency to try and make sure that there's access to healthy foods. Children, like, as I mentioned, are special to us. The child insecurity rate here in Angelina County is 26.1%. That's over 1 in 4 children. At some point during the pandemic, we saw that number go up to 35%. I think it's come back a little bit because things are getting a little bit better. We're opening up, and we're going to continue to watch and adjust those statistics. But still, that's 6,000 kids here in Angelina County that we want to make sure have access to fresh foods if their parents aren't able to provide it. So it's a drastic issue. One of the things that we did here, an approach that we took, was something innovative for us, in that we've always been a centralized food bank model. As I mentioned, our goal was always to provide support to our pantry partners. And in talking to the people at the TLL Temple Foundation, we came up with a concept of a resource center where the East Texas Food Bank will operate its own pantry and resource center here in Angelina County. So we're located in North Lufkin on 105 Lofton Street. It's in a building that used to be, that was owned by the William George Food Distribution Company right across the street. And we brainstormed this concept with Temple, and our goal there was to, I think we have a goal slide, our goal was to provide a one-stop shop to families. So it's not only a pantry, it's a model pantry, meaning that it's a pantry where people can go in and select their own foods rather than just to receive a box of foods that are pre-selected for them. And that's important because it's dignified service, but we also find that people waste less food if they choose what they'll eat. And a lot of times when we receive food drives, we saw our food come back to us because we've given out too many cans of garbanzo beans, which if we have a glut in garbanzo beans, everybody's getting garbanzo beans and they come right back in a food barrel, unfortunately. But so that's why we try to provide dignified service with a choice pantry, and that pantry has a fresh produce program, and and you're able to pick up once a week. Every family can be served there once a week. And it's a neighborhood that we find to be, one of those that are most in need. We've gotten down, as I mentioned, we talk about your county, but we also look at census tracts. And we look at the proximity of some of the census tracts that are most resource challenged, and to see if there's a census tract like that that's outside of the range of a pantry. We're starting to send mobile trucks to go into those neighborhoods on a neighborhood level. But I did want to introduce our branch manager, Rachel Collins, if you want to stand. Rachel is here in Lufkin, and we've got a staff of 2 others that are at the pantry, and several volunteers that have started to open. And also Laura Squires has just joined us from the TLL Temple Foundation. Thank you so much, Laura, for the partnership that we've enjoyed with you. And so what does it mean? We've got 7 other amazing partners here in Angelina County, and we're not here to compete. I always find that interesting when you talk about nonprofits competing when you have the same mission. We're here to augment the services that they provide, and what we've done is we've tried to, the most notable is CISC, Clausen, Huntington Food Pantry. We've got a Lufkin Spanish SDA church, Harmony Hill, the Salvation Army, and the Zavala Food Pantry. Those are some key partners that we're really trying to support. The other thing that we're doing at that resource center is going to be a little bit of a hub for them. They'll be able to get fresh produce. We installed a walk-in refrigerator that will hold 2 truckloads of fresh produce, so we're able to distribute more fresh produce broadly and make sure that all of those smaller pantries are able to handle produce where they can't handle it now on a pallet level. So we were really thrilled. On Monday, we had a ribbon cutting, and we officially launched the opening of the Deep East Texas Resource Center. We've been open, with soft openings since February, really getting our feet on the ground and kind of migrating past that box program that COVID had required, and now we've got it fully open and operational, and it's quite a beautiful pantry. All of the branding is all installed. You can see our hours. We're open from Tuesday through Friday, 11 to 1:30, 3:30 to 5:30. We really wanted to make sure that we were accessible to the people we serve who are working, because one of the statistics that's really important to understand is that most of the pantry recipients are working. They're working poor. And how can you get help if you have to be at work at the same time that the pantry is open? So we've really tried to augment the hours of our partners, and we've also tried to make service available on Saturdays. So that's a very important part of us. So we talked about feed, we talked about lead. So while we feed, in Feeding America, we talk about feeding the line, but we also talk about shortening the line, trying to get people to a position to where, they can not need to go to a pantry. So we can provide resources for education. We can make them smarter in how they manage their family budgets. And those wraparound services are real important. Currently, we have our benefits assistance supervisor there. Again, she does the SNAP programs, TANF, Medicaid. We've got a great partnership with GetCap to provide utilities assistance. The Texas Workforce Commission is going to be housing in there at times. We're also working at putting together some financial literacy programs to help people with their overall family budgets. Another important part of this is our nutrition education classes. We've got a demonstration kitchen that we installed. You can see Kinsey Jeffers is our registered dietitian. She's in charge of all our nutrition education programs, and we've got a staff of 4 nutritionists and 1 other RD on staff. They go throughout all the 26 counties, but this is a nice anchor down here in Angelina County for nutrition education. And that's our benefits assistance manager, LaTanya Sanders, and she's helping a lady fill out one of the SNAP applications, which is a greatly needed service as well. So we're just delighted to be able to pilot such an innovative program for us in East Texas, and we've got plans to open 2 more of these over the next 3 years. Preliminarily, our plans are to move into Longview. We're actually in discussions with a site in Longview, and in Texarkana, probably in the next 3 years, we'll be trying to be opening one of these model pantry sites in Texarkana. And alongside of that, our distribution center, I don't know if many of you have ever been to the East Texas Food Bank Distribution Center in Tyler, but we don't have a pantry there, but we will. We're going to be opening our own model pantry and resource center right on our site. So we're really excited about the growth that we're undertaking here in East Texas. We're really excited about the partnerships here in Angelina County, and the energy is just amazing. So we're here to help, and you can contact us easily at the easttexasfoodbank.org, or if you want to contact more locally, it's DETRC, Deep East Texas Resource Center.org. There's some cards on the table with some more information on how you can contact us. So anyways, thank you all for giving us the opportunity. And if there's any questions.
Thank you so much.
Thank you.
Appreciate it. Anyone have questions? Okay, we're good. Thank you, Dennis. We're so happy to have y'all in Lufkin and partnering with all of us in Angelina County, and we thank you for all that you did for our community during COVID and for all that you continue to do. So thank you very much. I did see our 2 new employees come in the back, so I do want you to see their faces. Colleen and Jessica, they're somewhere back there. They're in the way back. So we're excited to have them. Again, Colleen is our new administrative assistant, and Jessica is our new director of leadership programs. And she'll be working with Tara for a while until she gets all the leadership programs down, and then we'll take it over. But we're excited. We're also excited to have Trey Henderson. As you know, this award should have been given at our annual banquet. And due to COVID and the fact that we could not get together earlier during the year, we've had to move this to a first Friday. But I do want to recognize and bring up Trey Henderson. He's chairman of the board of the Piney Woods Foundation to present the 2020 Golden Anvil Award. Trey.
Thank you, Tara. For those of you that don't know, the Golden Anvil Award is given to a group or individual that has performed above and beyond or done something extraordinary within the community over the previous year. And like I said, we normally give this at the chamber banquet, but because of COVID, that was unable to happen. But because of COVID, we have our winners. So watch this Josh Gentry, Jackie Zimmerman video, and let's see who our winners are.
They are heroes and so much more. Each and every healthcare professional in Angelina County is not just a hero, but a superhero to those of us who need their strength, their expertise, their skill, their dedication, and their compassion. And they offer that and so much more to thousands of our community who suffered the effects of the coronavirus despite the dangers it posed every single day.
People were getting discharged from the hospital and then a week later dying, and so that's unusual. That doesn't happen very often because the way it affects the body afterwards, from the blood clots and strokes and heart attacks that it causes sometimes after the infection.
Watching so many become ill with the virus, struggle to breathe, and then overcome and go home to their families, while others struggle ended in a different homecoming. It is difficult to understand how the virus impacted some patients much more critically than it had others. So many have died, but thousands more in our community have survived coronavirus because of our community's healthcare heroes. EMTs at the city of Lufkin and nurses at St. Luke's Health Memorial, Woodland Heights Medical Center, and the Angelina County and City's Health District. Each organization selected a person to represent their amazing staff as recipients of the 2020 Golden Anvil Award, which is dedicated to all the amazing healthcare providers in our community who continue to go way above the call of duty to care for our friends and neighbors as we enter the second year of the pandemic.
We've been monitoring COVID even before it hit the United States. So this wasn't something new for us. This is something that we do on a regular basis. So our team started preparing in advance, and then once we had our first COVID positive test here in our county, our administrator rallied our hospital partners, our emergency partners. We started having meetings, and then we did just a social media blitz on social distancing and masking up and the importance of wearing the mask and exactly what COVID was.
Each discussed the struggles with how quickly the virus changes lives, not only for patients and their families, but also their own.
At first, we're just dealing with numbers and results and not being able to actually put a face to it. And then as there was an increase and a spike in COVID positives that were, hitting our long-term care facilities, we were getting these demographics that actually had the residents' pictures attached. And so it was finally putting a face with a test result. And then we were finding out that they had been shipped to, one of our local hospitals. And then a few days later, we were receiving discharge summaries that they had passed from COVID. And that was really hard to get those test results in and then have to match it and then close out their case.
A year ago, our heroes were learning how to medically care for patients who had the virus no one knew how to treat or how and why it affected almost every patient in a different way. Still, they continued to battle for every patient every day.
We get to work every day, and there for a while it was every day. It was like, okay, we're going to be able to do this 12 hours at a time. Sorry. So we do it 12 hours at a time some days.
And that battle to save the friends and neighbors extended into one of personal survival and self-preservation.
So one of the worst days is having the patient that you've worked with and they start showing improvement and then they just decline so quickly and that you lose them. Any of the ones that you lose, it's hard.
In the early months, many of the patients arrived at the hospitals by ambulance, and it is those heroes on wheels who arrived at every emergency, not knowing if they were going to be face to face with someone who had the virus. Chief Moody watched the coronavirus pandemic unfold from the beginning and took an active role as part of the solution when he and his family became two of the initial test subjects for the vaccine.
I've had nothing out of the ordinary, no signs and symptoms of any immune system that's the most serious problem with a vaccine, is actually kicking your immune system into overdrive. And so I had no signs and symptoms of an anaphylactic reaction or anything like that. And I am a person who has had a very serious reaction to medication, so I'm prone to that, but I had no issues with it.
Before COVID-19 was on anyone's radar, Moody was preparing his staff and his stash of personal protective equipment to protect his team from flu outbreaks.
In the back of the ambulance, we're in real close proximity to the patients that we care for. And so I wrote a flu pandemic response plan, and I did that in December. And so we actually had a large supply of N95 masks. We had about 19,000 of them at the beginning of the pandemic.
As it became clear the virus would make its way to the United States, Moody was again ahead of the curve, ordering Tyvek suits, goggles, and more N95 masks. And as soon as he saw the first case in Texas, he had his staff wearing their mask on every call. However, in some cases, even all the protective gear was not enough to keep the paramedics safe.
We did have 2 cases where people become infected from calls. Both were from the same thing. It was before we got the face shields, and COVID had a real problem with projectile vomiting. And so they actually both got projectile vomited in their face, and so that overcome all their protective gear. That's what COVID's not a pleasant thing to catch. Some people have very minor symptoms and other people have very severe symptoms.
Wearing the extra equipment and the additional workload, as each day averaged the 5 to 7 additional ambulance calls per day, was exhausting.
People, when they decide to go to the hospital with COVID, they're sick. They're really sick. And so we've had numerous COVID cardiac arrests, which really is a mental strain, because that person has a very high dose of the virus in their body. And so doing the compressions and everything in the back of the closed space, it's a very infectious atmosphere.
At the hospital, the care teams in the units devoted to COVID patients working 12-hour shifts to care for patients who could not have visitors. No friends, no family.
The one thing I would tell the public is that we do care about their mom and their dad, even though they can't come see them in the hospital. That we're giving them 100%. We're talking to them, we're turning them, we're singing to them, staying in the room with them, holding their hand, that we do care and that we are taking care of them. And I know they can't be there, and that's hard. It is so hard. But I promise that the staff is taking care of them.
I hope that they understand that we really have done our due diligence to do the very best we can, provide the best care that we can for their family, especially those that lost loved ones. I hope that they understand that we didn't just give up on them, that we did the best we could every day.
Continually changing protective gear, caring for patients, and keeping their spirits up despite not being able to see their loved ones has been challenging.
Our team has stepped up, and for the most part, everyone has been extremely positive. Yes, we get run down, but then someone cracks a joke, makes us all laugh, and we just keep going.
Our Angelina County community is beyond grateful for every healthcare person who every day goes to work and cares for those suffering with this virus.
I feel like we've had the support of the community. They've been out, they've put out signs, they've been out and had prayer where they've turned their vehicles on with the lights on, and people have stood at the windows and waved, and it just means a lot. It does.
They definitely feel appreciated. As I talk to them, their morale is high, and they know that the community has appreciated what they've done for them.
Now, more than a year later, the virus is still here, and our dedicated healthcare workers continue to accept the challenge and tackle what has become the most difficult and unpredictable virus they have encountered.
Thank you for recognizing the angels and the staff that are taking care of the patients. It's all about them, and it's all about teamwork, and how much we appreciate their support. And having the support of your community it means the world.
please recognize the 2020 Golden Anvil Award winners, y'all. Angelina County Healthcare Superheroes. Represented today are Sarah Adams from the Angelina County and Cities Health District, Kara Kamerling from the Woodland Heights Medical Center, Randy Harmon with St. Luke's Memorial Hospital, and Jesse Moody with the City of Lufkin. And I'm telling you, they're awesome. Please come forward. I'm going to make a disclaimer here too. I have to plead guilty. When we give these awards away, we normally just give one to a group or an individual. We couldn't let that happen. So what we did was we had one golden anvil, gold-plated anvil. So we put out quickly for 3 more, and they're on back order. The foundry down in Houston couldn't get them here fast enough, so we have one, and so this is.
Grab it.
Yeah. What's going to happen is we got some more coming. We'll make it happen. So, but really, the anvil goes on the front of that plaque, and so yeah, we're kind of passive. That's going to. So we'll hold one up there. But anyway, I need to raise the disclaimer. I was not anticipating 4 winners this time, and it takes a while to get those. So we're going to order a whole bunch next time to make that happen. But anyway, these are our superhero winners, and. We're going to get a couple of quick pictures.
Musical chairs. Give them another round of applause. Very, very well deserved. And we will get the anvils to you as soon as I'm taking it back. Thank you. This is my weapon at the chamber. Excuse me. Thank you, Trey.
Thank you, Kara.
I should have watched that video before I got here.
I've watched it 5 times.
Well, we'll just cry together.
And Jackie and Josh, one more round for them.
Yeah, they did a great job.
That was awesome.
It's been such a great First Friday. It's so nice to have 150 people at a lunch together. And we do just encourage you to continue to be safe and to make smart choices. Our next First Friday Luncheon will be Friday, June the 4th, back here at Crown Colony. Please come. The Angelina Arts Alliance will be presenting their brand new season, and they've got a lot of great things that they're bringing back to us that we didn't get to see last year. So make sure that you come in and enjoy that luncheon. A few things coming up that we want to remind you about. The Chamber is hosting a Chamber Blood Drive next Thursday, May 13th in our community room. If you would like to register for that, please contact the Chamber. We also have sign-up forms in the back. We have to have 40 donations to actually be counted. We have 2 people signed up, including myself. So we would love for you to challenge other businesses. Get with your employees, challenge them to do it. Challenge a business that's similar to you to see if you can beat the number of employees that you can bring versus them. Challenge your leadership Lufkin classes. You say you're the best class ever. Let's challenge each other's classes. But we would love to be able to have a full blood drive and to be able to get back to the community. We're also really excited. Our Business After Fives are starting back up. Our very first one in over a year will be with McWilliams & Son Heating and Air Conditioning and Lemon Seed Marketing at 5:30 p.m. on Thursday, May the 20th at their new location down in Diboll. Make sure that you come and network that evening. And Friday, May 21st is Power Networking Breakfast held at the community room starting at 8 a.m. We'll hear from Shane Tatum, President and CEO of Integra Insurance, on why you need core values. And we would also like to do our on-time drawing, which is sponsored by ServPro Lufkin, South Nacogdoches County. Will you draw one for me?
Yes, ma'am.
Let's see who's the lucky winner. Ooh, not that one. Oh, Randy George Jr. I know you're here. Awesome. We have a check for you, and Randy, make sure you come to the front because we want to get your picture with the ServPro crew. Thank y'all for coming. Enjoy this beautiful weekend. Enjoy it before it starts raining again. But enjoy, and thanks for coming. Bye-bye.